Last time, we looked at Mississippi, a state where the story goes back to who owned the land. This time, we're going somewhere the story is almost the opposite. A state that didn't lack industry. A state that had one of the most valuable industries in American history running right under its feet for over 100 years. And yet, by nearly every measure, it's now one of the poorest states in the country. This is West Virginia. And this is the story of what happens when an entire state's economy is built on a resource that eventually runs out. Let's start, like we always do, with the numbers. West Virginia's poverty rate sits around 17%, among the highest in the nation. Median household income ranks near the bottom of all 50 states, but the number that tells you the most isn't poverty, it's population. West Virginia is one of only a handful of states that has been steadily losing people for decades, not gaining them. While most of the country grew, West Virginia shrank. Life expectancy here is among the lowest in the country. Drug overdose deaths, driven heavily by the opioid crisis, have hit West Virginia harder than almost any other state in America. Labor force participation, the percentage of working age adults who are actually in the workforce, is one of the lowest in the nation, meaning a huge share of adults here are neither employed nor actively looking for work. These numbers don't describe a state that never had opportunity. They describe a state that had enormous opportunity, built an entire economy and identity around it, and then watched that opportunity leave, while the people mostly couldn't. To understand West Virginia, you have to understand coal, because for over a century, coal wasn't just an industry here. It was the identity of entire towns, entire counties, entire generations of families. Beginning in the late 1800s, coal companies moved into the mountains of southern West Virginia and built what became known as company towns. The company owned the housing. The company owned the general store. Workers were often paid in company-issued scrip instead of real currency, which could only be spent at the company store at company prices. It was a system that generated enormous wealth for mine owners and investors, many of whom lived far outside the state, while the people doing the actual mining lived in company housing, shopped at company stores, and had very little left over at the end of the month. This is one of the most important and least understood parts of the story. A huge amount of the wealth that coal generated never stayed in West Virginia. It flowed out to investors and companies headquartered elsewhere, while the environmental and human cost of extraction stayed behind, in the mountains and in the miners' own bodies. Coal mining is also dangerous work. Black lung disease from years of inhaling coal dust became so common in mining communities that it's still a major public health issue in the region today, decades after the peak of underground mining. Mine explosions and collapses killed thousands of West Virginia miners over the 20th century. The work built the country's steel and power industry. It also built a legacy of chronic illness and injury that the region is still living with. Then, starting in the mid-20th century and accelerating sharply after the 1980s, the coal industry began to shrink. Mechanization meant fewer workers were needed to extract the same amount of coal. Cheaper natural gas, driven by fracking technology in other states, started replacing coal as a power source. Stricter environmental regulations on coal-fired power plants reduced demand further, and globally, other countries began producing coal more cheaply than Appalachian mines could. The result, coal mining employment in West Virginia fell from well over 100,000 jobs at its peak to a small fraction of that today. And unlike a factory that can retool to build something else, a coal mine can't easily become anything other than what it is once the coal runs out or becomes too expensive to extract. Here's what makes West Virginia's story different from a lot of other declining regions in America. When a factory town loses its factory, workers can often move to a nearby city for a different job. When a farming region mechanizes, workers can sometimes shift to a different type of agriculture or leave for opportunities in a reasonably close metro area. West Virginia's coal counties are geographically isolated in a way few other places in the country are. The terrain is steep, mountainous, and difficult to build major infrastructure through. Many coal towns were built deep in narrow hollows, accessible by a single road, originally built to move coal, not people or commerce. When the mines closed, there often wasn't a nearby city to absorb the workforce, and there wasn't good enough infrastructure to easily commute somewhere else either. So what happened instead was outmigration on a massive scale. Younger residents, especially those with more education or transferable skills, left the state entirely, often for good, heading towards cities like Charlotte, Columbus, or Washington, D.C. What was left behind in many of these coal counties was an aging population, a shrinking tax base, and towns with far more retirees and far fewer working-age adults than the national average. This is also where the opioid crisis enters the story, and it's a hard part of West Virginia's recent history to leave out. West Virginia has had the highest overdose death rate of any state in the country for years. Multiple factors contributed to this. The physical toll of decades of dangerous manual labor left many former miners dealing with chronic pain. Prescription opioids were aggressively marketed and overprescribed in the region during the 1990s and 2000s, and economic despair in communities that had lost their entire reason for existing created conditions where addiction spread rapidly. It's not the cause of West Virginia's poverty. It's a consequence of it, and now a compounding factor making recovery even harder. The combination of job loss, outmigration of younger workers, and a public health crisis this severe is difficult for any local economy to recover from at the same time. It's worth pausing on what outmigration actually does to a small town's economics, because it's easy to say people left without understanding the compounding effect underneath it. When a working-age adult leaves a county, that county doesn't just lose one taxpayer. It loses a customer for the local grocery store, a potential volunteer for the fire department, a parent whose children would have filled a classroom seat, and often a caregiver who might otherwise have looked after an aging relative still living there. Multiply that by tens of thousands of people over several decades, and you get counties where the remaining population skews significantly older, school districts that have had to consolidate or close buildings entirely because there aren't enough children left to fill them, and volunteer fire and rescue squads struggling to find enough active members to staff a single truck. This is part of why West Virginia's population decline is self-reinforcing in a way that's hard to interrupt from the outside. It's not just that people left because jobs disappeared. It's that every person who left made it slightly harder for the next person to justify staying. Two systems make this cycle especially hard to break: education and healthcare. West Virginia has one of the lowest rates of adults with a 4-year college degree in the country. Part of this comes down to a pattern common in resource extraction economies. For most of the 20th century, you didn't need a college degree to get a well-paying coal job, so college wasn't seen as necessary the way it was in other regions. That made sense when the mines were hiring. It became a serious disadvantage once they weren't. And here's the harder part. West Virginia actually does relatively well at getting students into college. The real problem is what happens after graduation. Many young West Virginians who do earn degrees leave the state for job opportunities elsewhere because the industries that would hire them, particularly in technology, finance, and advanced manufacturing, are heavily concentrated in other states. This is often called brain drain, and West Virginia has one of the most severe cases of it in the country. The state effectively pays to educate young people who then build their careers, pay their taxes, and raise their families somewhere else. Healthcare access compounds all of this. Rural West Virginia has some of the most severe doctor shortages in the country. Several rural hospitals have closed or nearly closed in the past 2 decades. For a population that is older, sicker on average due to the legacy of mining-related illness, and dealing with one of the worst overdose crises in the nation, having fewer doctors and fewer hospital beds isn't a minor inconvenience. It directly worsens the same life expectancy and mortality numbers we started this video with. So what's actually being tried? There have been genuine efforts to diversify West Virginia's economy. State and federal programs have invested in expanding broadband access to attract remote workers, offering tax incentives and even direct cash incentives for people to relocate to the state and work remotely. Tourism, built around the state's mountains, rivers, and outdoor recreation, has grown into a meaningful part of the economy in some regions, particularly around the New River Gorge, which became a national park in 2020. There have also been targeted investments in retraining former coal workers for jobs in fields like healthcare, technology, and renewable energy, including some solar and wind projects built on reclaimed former mine land. But these efforts remain small relative to the scale of what was lost. A remote work tax incentive program can bring in a few hundred new residents. It can't replace tens of thousands of coal jobs that supported entire county economies for 100 years. Tourism creates real jobs, but often seasonal and lower wage ones compared to what mining once paid. And retraining programs only work if there are actually new jobs waiting on the other side of the training, which, in many of the most affected counties, still isn't the case. The honest picture is a state in transition, but a slow and uneven one. Some counties, especially those near recreational tourism or within reach of the DC metro area, are stabilizing or even growing. The deep coalfield counties in the south, the ones that were most dependent on mining, are still shrinking year after year with no clear replacement economy in sight yet. West Virginia's story isn't really about coal running out. Resources running out happens everywhere eventually. It's about what happens when an entire regional economy and an entire regional identity gets built around a single resource, with the wealth flowing outward the whole time and no serious plan in place for the day the resource stopped being profitable to extract. The people who worked those mines and their children and now their grandchildren didn't make the decision to depend entirely on coal. That decision was made 100 years ago by companies and investors chasing the most profitable extraction possible, with very little thought given to what the region would do once the coal was gone. The bill for that decision came due decades later, and it's still being paid today in overdose statistics, in population loss, in hospitals that had to close their doors. It's easy to hear a story like this and think of it as ancient history. It isn't. The mines are still closing. The population is still shrinking. This is happening right now in towns that most of the country has stopped thinking about entirely. There's one more state in Appalachia carrying a very similar weight, shaped by a very similar history. That's next. If this is the kind of story you want to keep seeing, subscribe, because we've still got 48 states left to map.